Hi, today I want to talk to you about the symptoms of thyroid problems and thyroid testing. My name is Dr. Lori Cayley. I am a functional medicine practitioner, and I help women who have thyroid conditions to reverse their thyroid conditions naturally so that they can experience optimal health and get their lives back. What I hear commonly from women is that they don't fit in their clothes anymore. They have to keep buying new clothes with bigger sizes because they keep gaining weight. They can't take it off. They are so tired. They have a hard time getting out of bed in the morning. They go to work and they're not as productive at work as they used to be, and it's affecting their performance. They don't have the energy to play with their kids. They can't go outside and go to the playground with their kids or do the things that their kids love to do because they are so fatigued. They don't have the time or they can't put in the necessary attention to their relationships with their spouses. They don't have sex drive anymore. That's affecting their relationship. No one understands either. Their partners don't understand. Their kids don't understand. The job doesn't understand. They have brain fog, so that's affecting their performance at work. They have cold hands and feet, so they go to work and they're freezing. They have carpal tunnel syndrome, have anxiety and depression that affects every area of their life. If this sounds familiar to you and you went to your doctor told you that your thyroid is normal because the TSH test is normal, but maybe you need to change your diet. Maybe you need to work out more. How about take this prescription for an antidepressant? How about none of that is good advice? I mean, changing your diet, sure, but what are they telling you to reduce your calories? Most likely. They're not giving you good, sound nutritional advice. Working out more isn't the answer because if you're taxing your adrenal glands by working out too much, that's just making the problem worse. And giving you an antidepressant for a condition that you don't need, what you need is to figure out what's going on with your thyroid. But if they're just looking at a TSH test and they're going by what the lab normal is, which is most likely 2.5 to 5, that's not good either, because there was a study done looking at the normal thyroid, what the labs call normal, TSH, and people who had TSH levels in the ranges of 2.5 to 5 were more likely to have higher triglycerides, have higher glucose levels, have metabolic syndrome, or more likely to trend towards metabolic syndrome. So just looking at the TSH level and looking at the normal lab value isn't a good way to approach this problem. So if you have these symptoms and your doctor is telling you that your thyroid's normal, you need to insist on a full thyroid panel. You need to look at all the thyroid hormones, which are TSH, total T4, free T4, total T3, free T3, reverse T3, T3 uptake, and the thyroid antibodies. You need to look at the full picture of what's going on, because all of the thyroid hormones are important in one way or another to be able to assess what's going on. And in functional medicine, we look at optimal values. So we're not just looking at what the lab gives as normal, because the lab just averages everyone who has been to that lab in the last year approximately. And it's mostly sick people going to these labs. So you're being compared to sick people, and that's where they're getting their normal value. And in functional medicine, we look at where we want the optimal values and where we want our clients to be. And TSH should be at 1.8. However, you can have what they're calling a normal TSH for 10 years, but thyroid antibodies would be present, showing that you have Hashimoto's. And if you have Hashimoto's, that's an autoimmune condition, and that's what needs to be addressed, because when you address the autoimmune condition, then your immune system will then stop attacking your thyroid, and then you can start producing thyroid hormones on your own, or better than you were. So if you were put on medication, you likely could reduce that medication or go off of it if you figure out what the root causes of the problem are. So these doctors are not addressing the root cause. They're not investigating. They don't think that it's necessary. Actually, the insurance companies don't think it's necessary to look at the other thyroid hormones or to look at the antibodies, because their approach is just to give someone medication if the TSH is higher than what it should be in the case of hypothyroidism, or what they think it should be. But if I were you, if you're having these symptoms, insist on a full thyroid panel. If your doctor won't get it for you, doesn't know how to interpret it properly, and isn't looking at optimal values, then find a doctor who will. And if your doctor won't, you can always contact me. I can help you to get the proper blood work that you need. So if you have any questions or comments, please just put them in the comment section of the video or send me a private message. Thank you so much for watching.